Welcome to the July episode of County Connection, where we talk about events, programs, and services of Summit County government. We have a great show in store for you today. We're going to be talking about safe disposal of medications, the annual senior rummage sale, the top 5 noxious weeds that could be in your backyard, and a great award that was recently won by one of our emergency medical technicians at Summit County Ambulance Service. So we are going to kick it off with our first segment here, talking about proper disposal of medications. We've all been in one of those situations where we have a prescription, we've healed whatever may have been ailing us, and those pills are sitting there in the medicine cabinet, and we're wondering what the heck to do with them. The landscape around medication disposal has changed across Colorado recently, and so we have rounded up some of our foremost experts locally in the community to talk with us about this issue. So we have Amy Weiland, Director of Public Health. Welcome, Amy.
Thank you.
And Jenny Hammock from High Country Conservation Center. Welcome, Jenny.
Thanks, Julie.
And Sheriff Jamie Fitzsimons. Welcome, Sheriff.
Thank you.
All right, so before we get into the particulars of how the landscape has changed recently, let's first talk about this issue of disposing of medications properly and why that's so important. Amy, can you kick it off for us?
Yeah, sure. Well, the prescription drug abuse problem is actually the largest drug problem now facing our nation. The CDC actually now recognizes it as one of the top 4 epidemics facing our nation, along with cancer, heart disease, and obesity.
And this has really been on the rise maybe over the past decade, would you say? Or?
That's correct, yeah. And actually, accidental drug overdoses have quadrupled since 1999. That's about 48 people a year are dying because of prescription drug overdose accidental deaths. And here in the county, in our last year, 2015, we've had 7 accidental drug overdose deaths in our community here locally.
So a big concern across the country as well as right here in Summit.
Huge concern. And we do know too that although most people do take their prescription medications correctly and as directed, 20% of people 12 and older do admit to taking a prescription medication without a prescription. And 68% of those are getting those from family or friends, oftentimes unknown to them. So it's a huge issue. And on our last Healthy Kids Colorado survey here in the community, 15% of the teens have used a medication without a prescription. So we're really concerned about these medications being in the home.
Right, sitting around, easy to access.
Having access, yeah.
Okay, so what are some of the other problems that we see in terms of improper disposal of medication?
Well, High Country Conservation Center is concerned about improper disposal because there are some adverse environmental health issues with flushing them down the toilet or throwing them away in the trash. Once those medications get into the waterways, the chemicals in those medications can affect aquatic life and cause hormone disruptions, which causes issues with reproduction, behavior, and it can change a whole ecosystem drastically. So we want to be sure that they're disposed properly so those effects don't happen.
Okay, great. David, how about the law enforcement perspective?
So in addition to the things that Amy was talking about these prescription drugs getting into the street, what we're seeing with some of these overdoses and some of these deaths is the prescription medications are then leading to illegal narcotics.
Okay.
So some of these opiate drugs are leading to heroin overdoses and heroin use because it's a lot cheaper once they run out of taking these medications out of medicine cabinets.
Okay, so that addiction then leads to going into black market and using illegal narcotics.
Yes.
All right. So, Amy, can you talk to us about what has changed at the state level in terms of what are the regulations around the ways we can collect and dispose of these substances?
Yeah, sure. So historically, drug take-back programs, at least those that are receptacles that were actually allowed to take controlled medications, which are the ones that we're really talking about today, including pain medications such as OxyContin, depressants such as Valium, and stimulants such as Ritalin, things like that, were only allowed to occur at a law enforcement agency. And now with the new regulations, any freestanding pharmacy or hospital or clinic that also has a pharmacy can now be taking those same substances along with over-the-counter medications.
Okay. And related to that, so we used to have an opportunity at the city market stores in Summit County, but that is no longer the case, is that right?
That's correct. Along with these new regulations, King Soopers has decided to no longer participate in the drug take-back program, unfortunately. And they did cease taking medications back on June 22nd.
Okay.
So
if people have seen those bins before and maybe taken advantage of them, they should know that those are no longer available.
That's correct.
Okay.
That's correct.
But we still do have a great option in Summit County. Jamie, can you tell us about that?
So at the Justice Center, and also one of the things about the ones you were talking about at City Market, that you were not allowed to take any narcotics to them.
Right.
So the one at the Justice Center, we have a box in there now. It's 24-hour access, 7 days a week, that you can dispose of anything now, including, because we partnered with Public Health about getting a needle disposal box, so you can dispose of needles there safely as well.
Okay, great. And that's something I actually didn't know. I sort of assumed, I guess, that it was just business hours, but you can get, but that's available 24/7.
24/7, they can buzz the door and get in and dispose those.
Okay. And for people who may not be familiar with the location of the Summit County Justice Center.
So it's 501 North Park. It's across the street from City Market in Breckenridge, across the street from the gas station.
Okay, great.
The things that obviously we don't want to see in there, if you're going to dump prescriptions in there, Colorado Department of Public Health and Environment asks that you black out your name on the label for your
Okay.
own protection. No aerosols, no suntan lotion, no things that aren't household prescription medications, we don't want to see in there. We will accept liquids if they're in their original container and they're not leaking.
Okay.
So-
And how about over-the-counter medications? Are those permitted in this box or no?
They are permitted. The only thing they don't want to see in there is vitamins.
Okay.
So
So really more on the medication side.
all on the household medication and household prescription. No illegal narcotics, no marijuana. And as I said, now we have a needle disposal box also.
Right. And that was a little bit of a problem that some sharps were getting into the box. And so what does that look like now? Is that right next to the box or?
Yeah, it's mounted right next to the box.
It's going to be mounted right on the wall next to the box with
Okay.
signage.
So any needles, anything else besides hypodermic needles?
Well, that's what we're most concerned
Okay.
about, are the sharps.
Gotcha.
Because it poses a safety issue for law enforcement who are packaging up the disposed drugs. So,
Excellent. Okay. Given that we're kind of at one location now in Breckenridge at the Justice Center, there have been some conversations in the community about where else we can provide this type of a service. Can you guys talk about that?
So I know that we do have one special collection event every year, usually runs alongside Town Cleanup Day, and we help facilitate that with the Sheriff's Department, that you can bring most of those narcotics prescriptions like these guys talked about, but also the vitamins, the over-the-counter drugs, those kinds of things as well, and then they properly dispose of them that way. So we do have that one event at least. Hopefully we'll run another one throughout this year and we can get collection that way as well.
Right. And those events have been really popular and
Oh,
successful.
absolutely. We had, I think, 700 cars come through on May 21st, so that was exponentially more successful than the last few events we've run. So,
Great. And then looking forward, what's going on in terms of providing
So
some
law
safety?
enforcement wise, besides the event that Jenny was talking about, we also participate in the 9 News Health Fair.
Oh, right.
So there's 2 events currently we would participate in. We're looking for any other events that we could participate in. In the meantime, I've taken this cause up to the chiefs of police of the other 4 municipal jurisdictions and started these discussions about who else might install a box in their lobby. And right now, Dillon Police Department, Chief Mark Hemminghouse is working with his town and Colorado Department of Health and Environment to get that installed in the Dillon Police Department. So that'll put one on the other side of I-70.
Okay. Great. So that'll be a little more geographically convenient for more people to have some multiple locations throughout the county.
Yeah, and we continue to reach out to other agencies that have pharmacies in particular, and we'll continue to do that so that we have more availability for convenience of taking the drugs out of the home.
All right, great. So if folks do want some more detailed information from any of you from your various perspectives on this issue, can you maybe go down the line and let folks know how they can best get in touch with you?
Yes, certainly. They can contact me through Summit County Public Health. My contact information is on the Summit County website.
Great.
I do want to mention that it's important to also recognize that people are continuing to use these meds, and there is good reason to use these medications. And so there are times when you will have to have them in the home, but it is important to make sure that you're using them in a safe way. And that would include reading the label, taking them as directed, perhaps getting a prescription lockbox such as this that can be fixed into a cabinet.
Oh, okay.
Because we've talked about adults and teens getting into the medications in the home, but what we haven't mentioned is the other safety issue is around young children also with their curiosity and when they're unsupervised can also get into these medications either in their home or at their grandparents' home,
Okay.
who are often using prescription meds.
Right.
And one child every 9 minutes is actually entering in an ER department because of accidental poisonings.
Wow.
So that's a huge safety issue as well. If we are going to have them in the home, to lock them up.
Okay.
And to make sure that you're talking with your healthcare provider about how you're going to be monitored while on these strong medications.
Okay. And then where would someone get a lockbox like this?
Yeah, most pharmacies do carry them up here. I know that Walgreens does carry them.
Okay, excellent.
Yeah.
And Jenny, how can people get in more information from you from the environmental perspective?
Yeah, so they can reach us on our website, highcountryconservation.org. We also serve as the recycling hotline, and that includes medications as well. So if people are wanting to get rid of either personal care products or maybe vitamins, we do have some methods in our box of tricks.
right.
They can reach out and call us on the recycling hotline at 668-5703.
Perfect.
Yeah.
Sheriff?
I can be reached through the Summit County website. The sheriff's office page
All right.
has our address, all our information, my contact information. But most people know where the Justice Center is, and that box is available 24/7.
All right, fantastic. Well, thanks so much to all three of you for coming in today and sharing all this great information. So make sure you take advantage of these great opportunities to safely dispose of those medications and keep them out of the wrong hands. Stick with us. We're going to take a quick break, and when we come back, we will talk about the Summit Seniors' largest annual fundraiser coming up later this month.